Heading over the border for medical or cosmetic procedures is a popular way that many of our South Texas neighbors find affordable health care. We get it. But there is a warning today. Dr. Surgeries joining us live to discuss the suspected fungal infections that are being reported. What are we seeing over there?
Good morning, John Thomas. I think, one of the key things is medical tourism is very popular because it's cheaper, cost effective, the wait period is less. More than 1 million Americans usually travel to different countries, whether you take Japan for a heart transplant, they go to Turkey for the kind of Ayurvedic therapy, they go to India, but Mexico, you're mainly going in for the dental procedures, some minor surgeries, bariatric surgeries, and cosmetic surgeries. Obviously it is cheap, but it comes with a challenge because one of the key things is the infection, because the infection control procedures, what we apply in this country is very different from the other countries, because over there it may not be regulated to the extent. So what you're describing is a serious fungal infection that happens actually right in our next door at Matamoros. 5 people who had gone through the surgery and they got the epidural anesthesia where you put a small needle in the spine, and one of the fungal infection was introduced to that, and one person ended up dying and 4 of them are in hospital. So they have issued a warning that we need to actually avoid or cancel any surgery till they figure it out where it emerged.
So what's the next step? Say I do have to go over, what questions should I ask, or what should I make sure the kind of post-operative care I'm receiving?
I think there is a couple of things. First of all, you have to see how reliable they are, what is their sterilization procedure is, what is the qualifications of the not only the surgeon who is doing, but all the other staff, what is the post-op follow-up, and even when you had a surgery, if you have any complication, if you want to come in, what's type of insurance, whether it covers or not, and even when you come in, what's the continuity of the care, because once you come in, the physician may not know what happens, so the adequate transparencies and transfer of the medical record would be the key thing.
That's the thing. I just hear of all the horror stories, and they have the shows that are dedicated to that. Botch on E! Entertainment. I mean, it's one of those, you just don't want that to happen to you. Dr. Surgeries, as always, you're the best. Thank you so very much for your insight and input. We hope you feel a little bit more safe, secure, knowing this information.